Hello, everyone. My name is Anushka Sheel, and I'm the National Director of Programs and Services with APDA. I'm excited to welcome you to this breakout session entitled Falls Management, How to Avoid Falling Head Over Heels with Parkinson's, an important topic led by our special guest, Dr. Jamie Engebretson. Jamie is a doctor of physical therapy and a board-certified clinical specialist in neurologic physical therapy. She works at M Health Fairview in Minneapolis, Minnesota. She specializes in Parkinson's disease and is trained in LSVT BIG and Parkinson's wellness recovery. And she has a long history of leadership at the APDA Minnesota Board of Directors. Jamie, the floor is yours.
Thank you so much for having me today. I look forward to talking to you all about this topic. As Anushka said, I'm a physical therapist. I've been practicing for 15 years, and I've been spending a lot of my time treating people with Parkinson's disease. And falls and balance issues are a big issue that people come to see me for. And so today I'm going to talk to you about fall management, how to avoid falling head over heels with Parkinson's disease. So we're going to talk about balance, then transition to falls, and of course, the reason why we're all here, fall prevention strategies. And so like I said, people typically experience a lot of falls and balance complaints when they end up being referred to therapy. And so it is one of the main symptoms of Parkinson's disease. And falls and balance issues can even present at the time of diagnosis with subtle changes. It might be that you're walking and you trip a little bit, but you're able to catch your balance. It could potentially be that you have to now sit or lean against the wall to put your socks and shoes on. Those little things can even be present, like I said, at the time of diagnosis. Now, balance issues can become more pronounced as the disease progresses. And unfortunately, individuals can still experience balance issues despite being optimally medicated. And then also, even if they have had surgeries such as DBS, there's deep brain stimulation. And so that's why we're going to talk about this today. And so when we talk about balance incorporates a lot of different systems within our body and our brain. And Parkinson's, unfortunately, affects a lot of areas within our body as well. So we're going to talk about how those two things kind of intertwine. And so when we're talking about our sensory system, a lot of individuals with Parkinson's disease have a reduced awareness of their body and also have some problems integrating information from the environment. So typically people might have a change in their posture or even slowness of their walking that they haven't been able to observe for quite a while. A family member typically observes that. Now, when we talk about the motor system, that's a lot of symptoms that we see in Parkinson's. Those are very evident. So there's slowness of movements, decreased coordination, and a reduced ability to adjust our posture or even reacting to balance. And then lastly, we're going to talk about touch on cognition. Now, cognition can change with Parkinson's disease. A lot of people have difficulty dividing their attention between two tasks because now they're focusing on doing just those automatic movements that they had just been able to do without thinking about it before. And another thing that can happen with cognition is sometimes people have a decreased safety and awareness of their judgment. Now, another symptom that can play a role in balance is freezing of gait. And I wanted to make sure I mentioned that here because, like I said, it is a symptom that does happen with Parkinson's disease, and maybe you don't experience it yet. So it's actually what it is an absence or reduction of movement despite the intention to move. And so some people describe it as feeling like they're stuck or glued like their feet are glued to the floor. Or people can also experience where they kind of take really short, rapid steps, and that pace is shorter and smaller than the rest of their body. And so the rest of their body is kind of falling forward as well. And so that can be a symptom of freezing of gait. Now, freezing of gait is typically temporary and it's involuntary. Some people only experience it it lasts like 2 seconds, and some people can experience freezing of gait 30 seconds, even up to a minute. And so definitely it can lead to potential balance issues. Now, freezing a gait can occur when someone starts to move or walk, It can also happen when you're turning. And a common thing that people will notice is that they have freezing of gait in doorways or when there's a change in flooring, as well as crowded areas. Now, how often does freezing of gait actually occur? So research has really shown that freezing of gait is typically about 26% of people with mild Parkinson's experience it. And it increases up to 80% for those that have severe Parkinson's. So as the research shows, that it's more common as the disease progresses in those later stages of Parkinson's. And it typically can happen more during an off period of medication. And so when we're talking about the off period, it's almost like right before your next dose is due, or when you just took a dose and those meds haven't kicked in. That could potentially be where a freezing of gait might happen. And so, like I said, those are really a big role in balance, and it's a common reason for people to have a fall. So let's talk about falls. Now, thank you so much for filling out that survey when you came into this talk. The question was, have you had a fall? Yes, no, or I've had a close call. Now, this is a common question that doctors ask when you come to see them. And so it's a really important topic, individuals with Parkinson's and just the older population as well. And so when we look at kind of the results from today, 55% of people joining us today have had a fall. 11% have had a close call. So that's just our small group of people. Let's take a look at what the research shows kind of more in the whole population of Parkinson's disease. So like I said, falls are a major problem. And about 60% of individuals with Parkinson's disease fall each year. That's each year. And of that 60%, 50% have had a reoccurrence of a fall. So that's a pretty significant number of individuals that are dealing with Parkinson's disease and these symptoms. And the one thing that also is why it's important that we're talking about this topic is because about 30% of people end up having a severe or serious injury from a fall. Maybe they ended up breaking their hip. They could break their arm when you kind of reach your arm out to kind of try to stop that fall, or you could even potentially hit your head. And all of those potential injuries could lead to hospitalizations and increase our cost of our healthcare money and whatnot, and potentially lead to you going to a rehab facility and not being able to get back home. And so let's talk about the kind of the impact of falls and balance instability. So if you had a fall, or even if you feel unsteady, you've heard maybe someone else is at a fall and all their issues that have happened as a result of fall, you can become fearful of falling. And that can lead to not doing as much activity. And when you don't do as much activity, you get weak. And that can also lead to, again, that fear of falling again, that can increase. But all that weakness and decreased activity can really impact your life. And so you might not be able to either do things around the house or potentially even go visit loved ones, visit someone for coffee. So it really has a big impact on someone's life. And then if they're not doing as much stuff, and they're weaker, they're going to have an increased reliance on family members and care partners. And so it really doesn't just affect one person, it affects like the whole team. So let's talk about different risk factors that are involved with potential falls. Now, the list on the left-hand side, it really applies to any older adult, not just those with Parkinson's disease. So a prior history of falls plays a role in potentially having another fall, being on multiple medications. And so research really shows that if you're on more than 4 medications, that's a risk factor for falls. And then having multiple chronic diseases as well, just the interplay of all the different diseases could impact someone's risk for falling. Now, when we look at the list on the right-hand side, those are more symptoms that people experience with Parkinson's disease. Orthostatic hypotension, is one of them, and that is where you experience lightheadedness or dizziness when you change positions, maybe going from lying down to sitting or sitting to standing, and it's typically due to a drop in your blood pressure. Now, again, like I said, that's a symptom of Parkinson's. There's also cognitive impairments, which we had mentioned earlier, that postural instability or the balance problems that we mentioned before, and also freezing of gait, which we talked about. And then as well, another thing is just leg weakness that people do experience with Parkinson's disease. So we've listed all these risk factors, but everyone wants to know, what can we do to help prevent a fall, right? About 55% of people have fallen in this group. And what can we do to help manage or prevent this from happening again? So when we look at fall prevention, it's not just one thing. It's a multitude of a number of different things kind of all coming together and being individualized for each person. So we're going to talk a little bit about 5 of the main topics here. So home modifications, medications, vision, assisted devices, and of course, exercise. Because I'm a physical therapist, we can't not talk about this topic. So let's talk about home modifications first. Now, I want you to take a look at your room that you're in right now. Or if you're not at home, think about what you could potentially do at home today to address potentially decreasing these falls. Now, first thing I would recommend you do is remove rugs. Remove those throw rugs that potentially are in the bathroom. It's a common location to have rugs kind of right in front of the sink or in front of the toilet. Remove those so that you don't trip on them. That's what typically happens with those throw rugs, is people kind of catch their toe, and that leads to tripping and losing their balance. Also, common place for rugs is in the kitchen too, in front of that sink, or even like those long entry or runners in the hallways too. Now, when we're talking about hallways or our walkways, we want to make sure those are clear as well. We all have a tendency to collect things as we live in our house or our apartment. And so really making sure that you remove those items from especially main walkways, maybe it's getting to the bathroom from the bedroom, making sure those are clear, because for individuals that have Parkinson's disease, it is more challenging to move through areas that are a little bit more cluttered or smaller. So really open those walkways up. We also want to make sure that you're having good lighting. So adding night lights, whether it's in the bedroom, in the hallway, and also in the bathroom, to really make sure that you can see your surroundings and you're aware of any obstacles that are out there. Maybe it's just placing a lamp within reach of your bed. I know having a light on in the middle of the night or turning it on can affect someone's potential, their spouse. But I think your spouse would be more than happy that you are getting up and going to the bathroom safely rather than having to be woken up because of a fall. And then when we look at kitchens and bathrooms, making sure that you're putting items that you frequently use within reach. So maybe they're being put on the counter so that you don't have to reach up over your head, because a lot of times when people reach up over their head, that can throw their balance backwards and off, and then they could potentially fall. And so putting those those items in an area that's easier to reach would be another thing to make sure that you do. And then when we're talking about bathrooms, making sure that you're installing grab bars near the toilet and the shower so that you have something to hold on to. And then don't forget about railings with the stairs, and especially thinking about those garage stairs. People kind of forget about those ones, and that's a common entryway that people go in and out of their house. There's a lot more things that you can modify in the house, but I just had a limited amount of time today. So let's talk about medications. Now, it's really important to discuss all your medications with your doctors to make sure that there isn't any interactions. So I encourage people to make sure that they're constantly talking about that and any new medications that are added to their regimen. Another thing with medications is making sure that you take your Parkinson's medications at a consistent time, because then you can have a little bit more predictability of your movements. And speaking of that predictability, you want to make sure that you're kind of looking at that med cycle, looking at throughout that day and determining is there a time of day that I have more balance issues? Is it in the morning before my meds have kicked in? Is it a little bit later in the evening when I just need to have a rest or something? Can I have an idea with that? And then the other area is orthostatic hypotension, really managing that. That's again, that blood pressure change. And so there are a number of different things that we can do to help manage that, which really involves your entire care team. So it's not just medications, it might just be exercise, it might be compression socks. But for you, it's really important to make sure that you're talking with your care team to address all of those potential interventions to help with that blood pressure. Now let's talk about vision. Vision can change with Parkinson's disease. A lot of people have decreased blinking. You can have dry eyes as a result of that. And then you can also have depth perception and clarity issues. And so it's really important to get that annual eye exam, because when we just look at anyone, no matter if they have a diagnosis of Parkinson's or not, people rely heavily on their vision for balance. And so it's really important to make sure that our vision is as strong as it can be, with whether we're using glasses or whatnot. The one thing that I will say is I have found in my practice, a lot of people have a tendency when they do have Parkinson's, they're looking down at the ground. And so when they have the progressive lenses or the bifocals lenses, you end up looking through that area that you're supposed to be reading. And so that really changes your depth perception. And so you have to really be careful on stairs, curbs, and uneven sidewalks. And then the other thing that you kind of need to maybe consider is, instead of having those progressive lenses or the bifocals, consider having a pair of reading glasses so that you can kind of decrease that potential of tripping or falling on those uneven surfaces or stairs. So let's talk about assistive devices. I know there's been a number of questions that have brought up about assistive devices. There are a number of different assistive devices out there, including walking poles, different types of canes, and a number of different types of walkers. Now, the topic of assistive devices can be an uneven topic for individuals for us to bring up in therapy, because sometimes people think, oh, it makes me look old. But if it's going to help you with your balance, I always tell people, I'd rather have you look safe and be confident in your walking rather than people being concerned about how your stability is. And so what I recommend is that someone goes and works with a physical therapist, determines what they are, if they're at a fall risk, and then they can determine what assistive device is best for them. Because it's really important to trial some of these devices before you decide to buy them. Some of them aren't cheap. If you're looking at a U-step walker, it's a good amount of money. It's a fair amount of money to pay right up front without trialing that. All right, so let's get to the topic that I love, exercise. A recent Cochrane review looked at fall prevention with Parkinson's disease and exercise, and they found that exercise may reduce the rate of falls by 26%. Now, with all of this research, it doesn't really look at specifically what you should do. They kind of give big topics. And so the main large topics are aerobic exercise, and they recommend exercising 150 minutes per week and doing it at a moderate intensity. And so you could hold a conversation, but you might be a little breathless with that. That's kind of the intensity that they want. And then strengthening is another category, and making sure that you're doing strengthening 2 to 3 times per week, and it should be progressive resistance. And so when we're talking about progressive resistance, we're talking about using weight machines, free weights, resistive bands, and even body weight. Now, the amount of resistance is going to depend on the individual and how strong you are. But ideally, the goal would be to gradually be able to kind of increase the repetitions or potentially increase the weight that you're using. And so then let's talk about balance. Balance is the last category that they kind of really talked about. And they recommend doing balance exercises 2 to 3 times per week for about 30 minutes. So let's talk about that. Now, balance exercises should be started early in the disease process. Now, if you're thinking, man, I've had Parkinson's disease for 5, 8 years and I haven't been doing this, it's not too late. Don't worry. You can still do some balance exercises to help with that stability and balance. Now, I do recommend, and the research really does show that you should be doing this with a skilled therapist so they can determine an individualized program for you. And then research really kind of, when they're looking at the type of exercises, we're looking at weight shifting, stepping reactions, reaching tasks. Those all will apply to balance and those freezing of gait symptoms too. So those are even programs like LSVT Big or power moves. Also looking at coordination, doing some divided attention tasks and different walking things. Now, balance exercises should be challenging is what the research really says. It shouldn't be super easy. You should be challenged. But the research also does show that once you're done with like an exercise program, maybe you do a bout of therapy, that there can be a regression in balance 6 to 12 months after you're done completing your program. And so that there's a number of factors with that. That could be that the disease is kind of progressing. It could also be that you kind of stopped doing your exercises. And so it's really important then to kind of keep doing something right after you do kind of an individualized program, which is why we talk about group exercise. Group exercise is super important to help with that bridge between potential bouts of therapy. And specific group exercises include dancing, Tai Chi, and boxing. If you're participating in a group exercise, I want you to just go ahead and put in the chat what you're doing so that you can kind of share with other individuals so that they have some ideas. Group exercise also helps with maintaining that motivation and that social connection. A lot of group exercises have a tendency to end up developing into a support group too. And the one benefit of group exercises is that it is supervised, which is what research does recommend. So some considerations for exercise is you want to make sure that you are potentially using a chair if you have some balance issues or set up for to kind of prevent some falls. You want to make sure that you're pacing your activities and you don't rush it. A lot of people that do maybe exercise groups that aren't developed for Parkinson's have a tendency to kind of rush through it. So make sure that you are paying attention to your own abilities. Fatigue can also play a role and lead to balance issues or falls. And so making sure that you're paying attention to your fatigue levels, and really important to stay hydrated. So what happens if you do have a fall? So you really need to make sure that you stay calm, assess for any injuries, and make sure that your surroundings are safe. And so let's talk about how to get up from that fall. A lot of people, you might fall forward, backwards, or to the side. So this gentleman fell on his back. And so once he kind of figured out, okay, I'm safe, we're going to first roll kind of almost onto your side to be able to get up onto your hands and knees. Once you're there, you're going to try to crawl or move over to a stable surface like a chair. Get your hands up on the chair and then try to get that foot up so that you can stand up and recover your balance. Now, if you personally are, this is a great technique to use, especially if it's your loved one that fell. You can kind of talk them through this technique so that they can get up. So I want you to take home from this talk today about making balance symptoms are really common with Parkinson's disease. Almost everybody experiences some sort of balance symptoms. And you really want to make sure that you're proactive about balance and your fall management. And really don't forget about exercise. Exercise, you should be thinking about that like your medication. So you should be exercising every single week, just like you take your medications every single day. And then making sure that you're working with a knowledgeable physical therapist to develop an individualized exercise and balance program. All right, I know a lot of questions have been coming in. So
thank you so much. Falls prevention is so important. It's a big concern for our audience. So we're really grateful to you for sharing. We have a lot of questions that have come in. And the first I want to share is a question from Gaurav. He's asked, is there any specific exercise that can help to prevent falling backwards?
So that is a great question. There's a number of different things that you can do. There are some large amplitude exercises that include learning how to take that step backwards and working on those balance reactions. And so that is one thing. It's almost like a step backwards. But I would encourage you to make sure that you're working with a therapist to see exactly what situations that you do fall in. Another thing that you could think about is, if you're going to reach up for something, staggering your feet so that they're not just right next to each other. You're kind of staggering them so you got some balance and ability to kind of shift your weight too.
Great, thank you. Another question about exercising. This one came from Jagdeep. He's asked, what is the best exercise for shuffling of gait to prevent falls?
So that is a great one. The big thing is to work on your walking. And so thinking about taking bigger steps, picking up those feet. The other thing also is if you are shuffling because you're concerned of your balance, it might be working with someone to determine if you need a walker or a cane or even walking poles too. So it is trying to figure out exactly what is leading to that shuffling. But it is a pretty common symptom that people have, especially even when they get diagnosed, is that foot kind of shuffles. So ideally, if you can kind of think about taking bigger steps, trying to hit with your heel first, that would be the first thing. But again, like I said, trying to work with somebody to determine if there is even a need for like an assistive device too.
Absolutely. And the next question comes from a care partner, Cynthia. She asked, do you have a recommendation for helping someone get out of bed from an adjustable smart bed? The mechanical system on the bed doesn't allow for a railing.
Okay. So I am not I'm assuming that the mechanical smart bed is like a hospitalized bed where it kind of, the head comes up and whatnot too. The biggest thing that someone wants to do is they want to really work on rolling, because that's a big thing that people have a hard time with. And so working on getting a roll so that someone's almost like rolling onto their side and then using their arms to push up as their legs kind of come down. Again, it's a technique that is really working with either an occupational therapist or a physical therapist to kind of really fine tune is what I would probably recommend, because all the techniques are just a little bit different. But for sure, trying to roll onto your side and then push up from a sideline position could be a way to start.
Great. And we just have 2 minutes left. So very quick final question from Jacques. He has asked, should you wear shoes or slippers around the house or walk around in socks like I usually do?
So it all depends on what kind of slippers you're wearing. So if you have slippers that are basically like shoes, and that would be a better option. If you have, whether or not you have kind of smooth flooring, such as hardwood or kind of laminate, socks could potentially lead to you kind of shuffling or sliding. And so shoes are going to be a little bit more stable for individuals rather than stocking feet or those slippers that you kind of can easily slip on and off. So you really want a footwear that stays well onto your foot.
Great, thank you. And that is all the questions we have time for today. If you posted a question in the Q&A section that didn't get answered, please copy it now and add it to the community section of the Whova platform entitled Remaining Questions from Presentations. And we'll do our best to answer your questions there. But really, thank you so much to Jamie for being here with us today. And thank you to all of you who joined from home. If you're interested in this topic and would like to learn more, I recommend checking out the APDA Let's Keep Moving webinar series on YouTube, led by physical therapy experts like Jamie. And we put the link to it in the chat box, along with a helpful blog post on this topic as well. We're taking a quick break, but don't go far. We'll be back in 10 minutes to begin our next set of breakout sessions. We have lots of great options available, so please take a look at the agenda now and decide which session you want to join next. See you soon.